Have you ever assumed that because you did not change anything, nothing else changed either? One woman I worked with thought exactly that. Her doctors were the same, her prescriptions were the same, her health had not changed, and her Medicare plan had worked perfectly well all year. So when fall arrived, she did what a lot of people do. She let it renew automatically. No phone calls, no paperwork, no Medicare headache. Or so she thought. Then January came. She walked into her pharmacy to refill a prescription she had taken for months. The pharmacist rang it up, and suddenly the price was much higher than she expected. She looked at the pharmacist and said, "There must be some mistake." But there was no mistake. The medication was still covered. It had simply moved to a different drug tier. And the pharmacy she had always used was no longer offering her plan's preferred pricing. She had not changed, but her plan had. And that one surprise at the pharmacy counter is exactly why reviewing your Medicare coverage every year matters. Not because you need to switch plans every year, you may not. But keeping your plan should be a decision you make with confidence, not an assumption you discover was wrong in January. One of the biggest misunderstandings I hear is this: "Robin, if I review my plan, does that mean someone is going to try to make me change it?" No, absolutely not. Sometimes the best result of a Medicare review is simply this: your current plan still fits your life, keep it. That is a successful review. The goal is not change. The goal is clarity. So today, I'm going to walk you through the 5 things you should review before allowing your Medicare plan to renew for another year. And I created a free Medicare open enrollment checklist to help you follow along. You'll find it linked below this video. Let's go back to the woman at the pharmacy. Her assumption was completely understandable. She thought, my doctor hasn't changed, my medication hasn't changed, my health hasn't changed, so my plan should still work the same way. That sounds logical, but Medicare Advantage and Part D prescription drug plans can change from one year to the next. The premium may change, the deductible may change, your copayments may change, a medication may move to a different tier, a pharmacy may stop being preferred, a provider may leave the network, a benefit you used may be reduced. Your plan may renew automatically, but that does not mean every detail stays frozen in place. That is why your plan sends an annual notice of change. It explains what will be different in the coming year. Unfortunately, that notice often arrives looking like every other piece of important insurance mail. You glance at it, you place it on the kitchen counter. Then you tell yourself, "I'll read that later." And we all know what happens to later paperwork. It goes into a pile. Then another pile grows on top of it. Then the holidays arrive. And suddenly it is January, and your pharmacist is telling you a prescription now costs 3 times what you expected. There is another side to this story. Sometimes your Medicare plan has not changed in a way that creates a problem, but your life has. Imagine someone who chose a plan when she was only seeing her primary care doctor twice a year. Then, during the year, she received a new diagnosis. Now she is seeing a cardiologist. She is going to physical therapy. She needs care through a particular hospital system, and she has started 2 new prescriptions. The plan that fit her beautifully before may not fit those new needs in the same way. That does not automatically make it a bad plan. It simply means the plan and the person need to be reviewed together. Because Medicare is not just about choosing a plan. It is about choosing coverage that fits your actual life. Picture yourself sitting at the kitchen table. You have your annual notice of change. Your prescription bottles are lined up nearby. You have your provider list, your reading glasses, and a cup of coffee that may need reheating more than once. Here are the 5 things to review. Number 1, your prescriptions start with your medications. Write down the exact name of each prescription, the dosage, the quantity, how often you refill it, and the pharmacy you use. Then check whether each medication will still be covered next year. But do not stop there. The woman from our opening story could have looked at the plan's formulary, seen her medication listed, and assumed everything was fine. Her medication was covered. The cost was the problem. A prescription may move to a different tier. It may require prior authorization. It may have new quantity limits. Or the plan may require step therapy before covering it. So instead of only asking, "Is my medication covered?" ask, "How will this medication be covered next year, and what will I actually pay?" That second question can save you from an unpleasant surprise. Number 2, your doctors and specialists. Next, make a list of the healthcare providers you want to keep. That may include your primary care doctor, specialist, hospitals, outpatient facilities, therapists, and medical equipment suppliers. Here is where people often get tripped up. They call a doctor's office and ask, "Do you take Medicare?" The office says yes, and they assume everything is settled. But taking Medicare does not always mean the doctor participates in your exact Medicare Advantage plan. Those are two different questions. The better question is, will you be in network with this exact plan next year? And verify that information with the insurance plan as well. Because discovering a network problem while you are sitting in a specialist waiting room is not the kind of plot twist anyone needs. Number 3, your pharmacy. Now let's return to that pharmacy counter. Your pharmacy may still accept your insurance, but it may no longer be considered a preferred pharmacy under your plan. That difference can affect what you pay. Imagine two pharmacies just a few miles apart. At one pharmacy, your prescription costs $8. At the other, it costs $28. Same medication, same insurance plan, different pharmacy arrangement. $20 may not sound enormous once, but multiply it across several prescriptions and 12 months, now it matters. Compare the cost at your current pharmacy with other preferred pharmacies nearby. You may also want to review mail order options when they are appropriate for your medications and your lifestyle. Convenience matters, but so does knowing what that convenience is costing you. Number 4, your total costs. This is where a shiny headline can sometimes distract people. You may see a plan advertised with a $0 monthly premium, and $0 certainly gets attention. But a $0 plan premium does not mean zero healthcare costs. You may still pay your Medicare Part B premium, deductibles, co-payments, co-insurance, prescription costs, hospital costs, and other out-of-pocket expenses. Imagine two plans. Plan A has a lower monthly premium but higher specialist and hospital costs. Plan B has a monthly premium but lower cost for the care you expect to use. Which one is less expensive? You cannot know by looking at the premium alone. You have to look at the entire story. Review the monthly premium, medical deductible, prescription deductible, doctor and specialist co-payments, hospital expenses, medication costs, and maximum out-of-pocket limit. The cheapest looking plan is not always the least expensive plan for your life. Number 5, your coverage and benefits. Finally, review your coverage and additional benefits. This is where it is easy to become distracted by the extras. Dental, vision, hearing, fitness programs, over-the-counter allowances. Those benefits may be helpful, but imagine choosing a plan because it offers an attractive dental benefit only to learn later that your cardiologist is not in the network. That dental benefit may not feel nearly as exciting then. Begin with the essentials: your prescriptions, your doctors, your pharmacy, your medical coverage, your total cost. Then review the extras. The additional benefits should support a good plan. They should not distract you from whether the plan actually meets your healthcare needs. When should you start reviewing? Medicare Open Enrollment runs from October 15th through December 7th, but you do not need to wait until October 15th to begin gathering information. Start by collecting your annual notice of change, medication list, provider list, preferred pharmacies, expected healthcare needs, and the costs you paid during the current year. Starting early gives you time to ask thoughtful questions. Waiting until December 7th at 11:47 at night while trying to spell the name of a medication is not a strategy. It is a stress test, and Medicare already provides enough of those. Let me tell you about another kind of review. A client gathers all of her information. We check her prescriptions. They are still covered affordably. We verify her doctors. They are still in network. Her pharmacy is still preferred. Her total costs are manageable. Her benefits still support her needs. And after reviewing everything, the answer is keep your plan. Nothing was sold. Nothing was changed unnecessarily. No one created confusion where none was needed. She simply confirmed that her coverage still worked, and she walked away feeling confident instead of uncertain. That is exactly how this process should feel. You may want to look more carefully when a medication is no longer covered, a prescription becomes significantly more expensive, a doctor or hospital leaves the network, your premium or co-payments increase, your pharmacy loses preferred status, you expect to use more healthcare services, you have moved, or a benefit you regularly use has been reduced. One change does not automatically mean you should leave your plan. It simply means the story has changed. And before you move forward, you deserve to understand what that change means for you. The woman from the beginning of this video eventually reviewed her options. The lesson was not that she should have automatically switched plans. The lesson was that she deserved to know about the pricing change before she reached the pharmacy counter. That is the real purpose of an annual Medicare plan review. Not pressure, not switching for the sake of switching, preparation, peace of mind, and the confidence that comes from making an informed decision. So before allowing your Medicare coverage to renew, review these 5 things: your prescriptions, your doctors and specialists, your pharmacies, your total costs, and your coverage and benefits. To make the process easier, download my free Medicare open enrollment checklist using the link below. It will help you gather the information you need before reviewing your coverage. And when you would rather have someone walk through the details with you, you can request a personal Medicare plan review. I'll listen first, look at what matters to you, and help you understand your options without pressure. No call centers, no confusing 1-800 numbers, just Robin. Subscribe for more straightforward Medicare guidance, and I'll see you in the next video. That's Medicare minus the headache.